You're listening to In Good Health, the trusted news source for medicine, science, and technology. I'm Elizabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, why is suicide still a leading cause of maternal mortality?
In general, we don't focus a lot on either women's health or mental health. So then when you bring those together of like women's mental health, it's not really a public health priority for a lot of people.
But first, are X-rays and CT scans putting doctors in danger?
They're basically odorless, tasteless. You can't see them, you can't smell them, you can't taste them. And a lot of times their side effects take years to show.
All that and more this week on In Good Health. The 2023 film Oppenheimer brought America's attention back to World War II, specifically the making of the first atomic bomb. Physicist J. Robert Oppenheimer had been tasked with this project that we now know as the Manhattan Project.
The project to create a nuclear bomb, and from that, development of a completely new industry, the kind of nuclear industry, which didn't exist before World War II. And shortly after World War II grew extremely fast. It grew to overtake General Motors in terms of the number of workers employed. So there are hundreds of thousands of workers who were involved in the development of nuclear fuels, the production of weapons, and then after that, nuclear propulsion for submarines and ships and nuclear power generation, development of reactors.
That's Dr. David Richardson, professor of environmental and occupational health at the University of California at Irvine. He says that as America's nuclear industry boomed, a few other countries like France and the UK soon followed suit. And even in these early days, certain safety measures were taken to help keep workers safe. For example, anyone who entered a federal nuclear lab had to wear a radiation monitoring device called a personal dosimeter.
In the old days, that used to be photographic film that got darker as you were exposed to more radiation. As it was passing through your badge, it would also pass through your body, and proportional to how dark it got, it was like an X-ray film. It got darker and darker as radiation was passing through it. And so that became the basis for getting an estimate of how much radiation Jane versus John got on the job. Every month or quarter, you would develop the film and say, how dark did it get?
This technology is still used today, but has been updated and now fits inside each worker's badge. It measures radiation in units of gray.
It's a metric system, so a gray can be divided down into milligray. So 1,000 milligray would be 1 gray, just like 1,000 milliliters would be 1 liter.
There are 2 categories of radiation, ionizing and non-ionizing. Non-ionizing radiation is used in household items like microwaves and lights. But ionizing radiation, like in X-rays and CT scans, is what causes serious health issues.
It's been known for a long time that exposure to ionizing radiation can cause cancer. Probably the landmark study is the study of the atomic bomb survivors in Hiroshima and Nagasaki in Japan. And they're part of what's called the lifespan study. So they've been followed since shortly after World War II up till today.
And while this research has provided incredible insight into the health effects of surviving an atomic bomb blast, Richardson says people today are experiencing a different phenomenon. Instead of one extreme exposure to ionizing radiation, many of us, including nuclear workers and members of the public, are being repeatedly exposed to low-dose radiation.
We know radiation can cause cancer under certain high-dose scenarios like a bomb blast or radiotherapy treatment. But the questions are there risks? And if so, how large are those risks from the kind of more routine low-dose exposures that we might get at work or when we visit a doctor?
Dr. Mina McCary is an interventional radiologist at the Ohio State University Wexner Medical Center. He says that aside from cancer, some other known effects of long-term low-dose radiation exposure are radiation cataracts in the eyes, impaired memory and cognition, and negative effects on the immune system. And we're only just beginning to scratch the surface of health risks.
Radiation or X-rays, they're basically odorless, tasteless. You can't see them, you can't smell them, you can't taste them. And a lot of times their side effects take years to show. So that makes them even more dangerous than anything else we get exposed to.
There's a wide range of jobs that fall under the nuclear umbrella. For example, reactor operators, nuclear power plant and weapons production workers, and astronauts.
In the medical profession, there's a lot of people who work with radiation. So they might be what's called a rad tech, somebody who's taking x-rays of patients, or a physician who's involved in interventional cardiology, where they need to kind of view the patient as they're doing the procedure. And so they use a radiation source to kind of get a real-time image of what's happening inside somebody.
Even pilots need to be concerned about radiation exposure due to the cosmic rays they encounter in high altitudes. But if all of these workers are at a greater risk for developing cancer and other health issues, why does the nuclear industry still exist?
Often when we recognize something as, let's say, we identify that it's a carcinogen, it's an agent which can cause cancer, the move will be to remove or replace a known carcinogen with a less dangerous substitute. And so over time, hopefully the progress is we identify causes of cancer, we kind of minimize the exposure. And so overall, the population is getting less exposed to it. That's not the case with ionizing radiation. I mean, recently, kind of the general public's exposure to radiation has increased because we're using more and more of it in the medical field. So with the rise of CT examinations, for example, there's been a substantial increase in the general American's dose of radiation.
And instead of trying to find a substitute for ionizing radiation, we've progressively increased safety practices. However, Richardson says it's been a slow evolution of lowering the exposure standards. The International Commission on Radiological Protection is an independent organization that creates safety guidelines to protect against ionizing radiation. And though avoiding all contact is the ideal situation, these recommendations walk a thin line of keeping people safe while keeping the industry up and running.
We have kind of progressively been having tighter standards, but part of that, there's cost benefits. So we say, what are the risks and what can we reasonably achieve in terms of in a medical or occupational setting to kind of get down to those. And we've been doing better about reducing kind of the amount of exposures, at least in the workplace, that people reasonably can kind of get and still achieve the job that they need to get done.
For example, ionizing radiation is essential to so many medical practices that getting rid of it would set us back tremendously. So to help stay healthy, McCary says medical professionals have a long list of safety measures. But no matter how many safety precautions are taken, workers are still being exposed. Richardson wanted to know what the cancer risk is for different nuclear occupations, and if increased exposure correlates to increased risk. He's an internationally recognized expert in occupational health, and his research aims to guide employers and policymakers in building safe working environments.
So that's the challenge for the employers, is how to do that. And what we're helping them with, I hope, is getting them to understand what the magnitude of the risk is from those exposures. And then they have the challenge and the responsibility of figuring out how the work can get done in a way that does the best possible to protect the people on the job so that they can do their job safely and they can have a long career in the industry and yet not bear an undue burden of disease from accepting that job.
Richardson recently worked on a study published in the British Medical Journal that was a collaboration between America, France, and the UK. The researchers compiled records for more than 300,000 nuclear workers, going all the way back to the Manhattan Project.
So what we found was about a 50% increase in the rate of cancer for every gray of exposure they received on the job. On the one hand, that can seem like a lot, but most of the workers were not receiving a gray.
The current U.S. limit for occupational exposure is around 1/4 of a gray. And though Richardson says most of the workers they've studied weren't receiving anything close to a full gray exposure, they discovered that the amount of radiation exposure proportionately increased their cancer risk.
And why we were interested in that is because this was not like an atomic bomb blast. Most of the workers were very well protected from radiation. They were getting low doses of radiation, but year after year, they're accruing kind of a cumulative dose. The dose gets bigger over time. And those who accrued higher cumulative doses have higher rates of cancer.
Which is important information for people who are involved in creating occupational standards for long-term, low-dose careers. And though this will help fine-tune exposure regulations for workers, the public's exposure to ionizing radiation has dramatically increased over the years. McCary contributes this rise to diagnostic procedures.
Since the advent of CAT scans, and CAT scans are basically, it's a scan that has multiple x-rays in it, and then it creates an image that looks inside the body. the rate of utilization has skyrocketed because in the past, somebody has stomach pain, you have to examine them and you may or may not be correct, and you have to follow and get lab tests and wait. Now you can get a CAT scan immediately and look inside the body and know exactly what they have and if it's something serious or not and get to the next step.
Making it a very convenient tool. But McCary says diagnostic testing isn't the only worry.
When a patient gets one X-ray, that's just one test to diagnose a problem. And then we also use X-rays, the actual energy of the X-rays, to, in real time, look inside the body to do a procedure or to deliver a treatment. When we do treatments like a heart cath, for example, where somebody has a heart attack and they go in and they open the blocked vessel and they put a stent, for example, to open the flow, they're using continuous X-rays during that time to look inside the body so they can diagnose and treat. That's different from one X-ray that is being used in one time shot to diagnose something.
McCary says physicians can use lower energy X-rays periodically throughout the procedure to minimize exposure. But as Richardson's paper proved, even minimal exposure can increase the cancer risk. McCary says medical professionals need to be educated on the safety measures, especially since it doesn't look like we'll be finding a substitute for ionizing radiation anytime soon.
Since the advent of X-rays, we've had additional modalities that were invented, like ultrasound and MRIs, but nothing has really replaced X-rays. But, perhaps things that excite me about the future are artificial intelligence, also robotics. Maybe instead of having a human get close and get exposed to these things, maybe a robot can do some of the things that allow that exposure, so then you have reduce your risk. And then maybe artificial intelligence can help us, stratify patients, can help us optimize our protocols, can help us with maybe post-processing of the images so we can get images that are good without giving as much X-rays. But I think the future is to be, we don't know, but I think X-rays will always have a role.
You can find more information about Dr. Mina McCary, Dr. David Richardson, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. This segment originally aired November 2023. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.
Coming up, should pregnant women continue to take their antidepressants? When In Good Health returns. There are moments in life that stick out in the Rolodex of our memories. They may be catalysts for big changes or experiences that leave an indelible mark no matter how small they seemed at the time. It's these moments that serve as bookmarks when looking back on our lives. For Dr. Kara Zivin, the movie reel of her life snags on a snowy night in 2011. 8 months pregnant with her son, Zivin changed into her pajamas, brushed her teeth, then Googled which medications are safe for a fetus. She ended her bedtime routine by swallowing handfuls of various prescription drugs. Hours later, she woke up in a hospital bed, unsuccessful in her attempt to end her life.
There's all these things that contribute to your mental health all the way along your life. And I think there used to be this misconception that pregnancy somehow protected you from all of that. And maybe we want to believe that, but it's just not true. And in some ways, I went back to look at some of the data when I was writing this. I actually started writing about my personal experience first. I really wanted to understand what happened to me. But then as a researcher, I sort of felt this need to both dig into the data and then also do my own studies to try to understand these patterns.
One significant finding being that Zivin's experience wasn't rare. In the U.S., 1 in 5 women are diagnosed with mental health disorders during pregnancy or in the 12 months after giving birth. And while many of us are aware of America's shockingly high rates of maternal mortality, what's lesser known is that suicide is a leading cause, according to recent research in the journal Pregnancy. Though Zivin didn't realize it until college, she'd been struggling with depression for a majority of her life, a probable driver for her career in psychology. Following her PhD in health policy, Zivin joined the inaugural wave of researchers at the nation's first depression center created by the University of Michigan. Though her research focused on mental health conditions, Zivin hid the fact that she'd been in psychotherapy and taking daily antidepressants for more than a decade.
Some of it's a stigma, some of it was credibility. I was an early career faculty member trying to get tenure, trying to have a job, trying to be taken seriously. I think if you're young-ish, women trying to establish themselves and trying to be respected and trying to have people think well of you, it can be hard if you're basically announcing that you've struggled with your mental health and even later, some of the cognitive impacts that my care had. It's not how you want to present yourself to the world, right? And yet, I think certainly some of the people that I didn't tell would have been supportive. I was really worried about the stigma, being judged, being disrespected, being discounted, not just during that time, but sort of forever on afterward.
Zivin's ongoing battle with depression was a main worry in the couple's decision to get pregnant. One she details in her new book, Persevered, a maternal mental health memoir. She married at 34 and felt pressure to have a baby sooner rather than later, without time to settle into this new stage of her life.
We didn't have years behind us to prepare for this moment, if that makes sense. And so, I think of what happened to me in this period of like this perfect storm. I had this history of mental health, but wasn't sure how it was going to play out during pregnancy. I was newly married. I just bought a house. Became a stepmother. I was trying to get tenure, all of these different things happening all at once that really contributed to what ultimately ended up happening.
Like many women, Zivin decided to stop taking her antidepressants when she got pregnant. Though it's a common suggestion by healthcare providers, Johns Hopkins Medicine reports that antidepressants have not been known to cause birth defects. In fact, disregarding the mother's mental health during pregnancy can be riskier than the perceived threat of continuing to take medication. In Zivin's case, the rapid decline of her mental state happened pretty early in her first trimester. She says the main driver was a lack of sleep.
Like most people, even if you haven't had mental health conditions, if you string together enough days when you're barely sleeping at all, it really takes a toll. In some ways, to me, the insomnia was worse than the depression. And I didn't anticipate having that in my first trimester. Like I assumed that, towards the end of your pregnancy, when you're sort of larger and uncomfortable, and all of that, I could sort of picture that. But it happened really early on. And that really affected my mental health, especially because I was trying to work. I had a lot of pressure.
It became clear that Zivin needed professional help, and though she was surrounded by some of the best mental health researchers at work, she didn't want them finding out and risking her professional reputation. Instead, Zivin made a therapy appointment at the Depression Center under a pseudonym.
It was, like this made up name. And it was almost like, okay, celebrities have that when they're, like on the rest cure in rehab, and I mean, in some ways I asked for it, in some ways they wanted it because I was being treated where I worked, and that was pretty awkward, especially because this was for mental health. This wasn't for like cancer treatment.
On that first visit, Zivin sat in the corner of the waiting room, hiding behind a potted plant in case any of her colleagues walked by. Even as a mental health researcher, Zivin still felt the enormous weight of the stigma so many experience.
We don't have the same kind of stigma if you have diabetes or cancer or heart disease. And I think there's this sense sometimes of blaming the victim of like, it's almost like your fault. If you just had a better attitude, if you just tried harder, if you just took resilience training, that somehow you would overcome these issues. And then particularly when you add on pregnancy and, women and trying to think about, this idea that pregnancy is supposed to be a time of happiness and well-being and joy, looking forward to the next generation and all of that kind of thing. And so if that's not your experience, it's particularly isolating, guilt-inducing. Why am I not feeling the way all these other women around me seem to be feeling?
Despite mood disorders being so common during this time, Zivin says many women can feel like their symptoms are being dismissed by providers as just another thing to deal with during pregnancy.
In general, we don't focus a lot on either women's health or mental health. So then when you bring those together of like women's mental health, it's not really a public health priority for a lot of people.
As Zivin tried to continue juggling all the components of her life, the original plan of managing her mental health through talk therapy wasn't slowing her descent into a deep depression. She restarted medication, but her condition continued to rapidly worsen no matter what her doctors tried.
It was severe enough that it was going to be hard to figure out what to do beyond what they were already doing, which was, monitoring my medication and trying to stay in touch with me. Obviously, I wish I made different choices, and yet it's hard to know, would my health have declined regardless of some of the choices I made? I don't know. I never had another pregnancy quite intentionally after that experience.
That's not to say that this is every woman's experience who has a history of mental illness. In fact, Zivin's heard of numerous women who had similar challenges in their first pregnancy, then used that awareness to better support themselves through their next pregnancies. Though Zivin's book is a memoir, it's ultimately a case study on a side of pregnancy that's rarely talked about, complete with scientific research and notes from her own doctors. It's a life raft for women who may be silently suffering, thinking that they're the outliers, the defective ones.
And I'm trying to use what I learned and what I did to help because, if we're all sort of existing in our own little ecosystems of silence, then that doesn't help people. I think there's a whole community of women that have had this experience and also go on to bond with their children, recover, have good lives. It's not a, lifelong sentence, but that it really is common. 1 in 5 women go through this. And so just being mindful of that, I think could hopefully help at least some people.
Zivin's book, Persevered, is available now for pre-order. You can find more information about Dr. Kara Zivin and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
At Progressive, we're making things even easier. We'll help you bundle your home and car insurance together so you can save on both. Learn more at progressive.com or 1-800-PROGRESSIVE.
Medical notes this week. We may have discovered a new form of evolution. Scientists studied how insects coped with Hurricane Harvey in 2017 for a paper published in Nature Ecology and Evolution. They noticed that many bugs went through a type of evolution called spatial sorting. It changes the likelihood of which specific traits are passed on, like with natural selection. But instead of taking thousands of years, the change occurred almost instantaneously. Since it's often triggered by major natural disasters, scientists think we'll be seeing more of this evolution in the near future. Is winter the best season for our health? A mouse study reveals that these shorter days may have a positive effect on metabolism. The mice that were exposed to winter light hours experienced less weight gain and had a better eating schedule to support metabolic health. The work, which is published in Cell Metabolism, can't be accurately translated to humans, but researchers hope this study opens the door to figuring out how seasons affect our hunger pathways. Has education become an afterthought for our kids? The U.S. Department of Education has reported that chronic absenteeism in schools was at an all-time high after the pandemic. 2/3 of K-12 students were enrolled in education programs with high levels of chronic absence, meaning that 1 in 5 kids missed nearly 4 weeks of classes. While the numbers are slowly trending back down, the data is still much higher than pre-pandemic absenteeism. These absences put a greater stress on teachers and make learning much more difficult. And finally, breast milk is triggered by a baby's whine. Research in Nature finds that a newborn's cry tells the mother's brain to release oxytocin, a chemical that controls the flow of breast milk. This flood of hormones lasts for a few minutes, allowing enough time for a mother to feed her child. Without this process, there could be a delay in milk production, which leads to a frustrated baby and mom. And that's Medical Notes this week. I'm Mayan Vasta Betancourt.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website at ingoodhealthpodcast.org or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.